Welcome to the Living Well Beyond Cancer Survivor Series. Today's topic is cancer-related pain. Thank you for joining us today. Hi, everybody. My name is Daniela Bucio, and I'm a cancer rehabilitation physical therapist and lymphedema therapist at Baylor Scott and White Institute for Rehabilitation in Dallas, Texas. Thank you for joining this talk on cancer-related pain. Cancer-related pain is one of the most commonly reported side effects of cancer treatment, no matter the type of cancer you may have. This kind of pain looks different for everyone and is not experienced the same way in each person. Pain may be present at all stages of your cancer journey, from initial diagnosis through active treatment, and sometimes even into survivorship. Today's talk is going to focus on what cancer-related pain is and how cancer rehabilitation can help you combat your cancer-related pain. So, cancer is a journey, and we recognize that not everyone's path is the same. Everyone starts their journey in a different place. Your age, your beliefs, your support system of family and friends, your general health or well-being, among other factors that contribute to how you are starting your journey. Also, your destination may be different. Where are you aiming to go? Your destination may be finishing treatment and putting cancer behind you. It may be living with a chronic condition, managing side effects to lead as normal and independent life as possible. Your destination is working towards your goals and care. Once diagnosed with cancer, your path may take you through a variety of different choices: surgery, chemotherapy, targeted therapy, or radiation, all of which are customized by your cancer care team to meet your needs. With each specialized treatment, side effects and intensity of side effects may vary as well. The tolerance to treatment will be impacted by your general well-being, where you started your journey. Our team wants to help you prepare and keep your motor running smoothly throughout your journey. So let's start with the definition of cancer-related pain, also known as CRP. The International Association for the Study of Pain and National Comprehensive Cancer Network's definition is an unpleasant sensory and emotional experience associated with actual or potential tissue damage caused by cancer or cancer treatment that may affect quality of life and ability to function even after treatment ends. Before we move ahead, it's important to highlight two distinct parts of this definition. One, pain has both a sensory and emotional component associated with it. And number two, pain can be caused by the cancer itself or the associated cancer treatment. Your body is learning how to best manage cancer and its treatment side effects. So, as mentioned earlier, cancer-related pain presents itself in various ways. Physical pain is the nature of pain itself and what it's doing in your body. The sensory component of pain is how you would describe your pain, such as throbbing, aching, or burning, and where your pain is located. There's also an emotional component of pain. Depression and anxiety can be associated with pain in certain situations. The psychological, also known as cognitive component of pain, influences how you view yourself or the way that you think. And lastly, the behavioral component of pain. This refers to how pain may impact your ability to participate in social roles. So now let's talk about how your nerves work. The human body has over 400 nerves that are all connected like a highway system. Nerves have a small amount of electricity running through them at all times that's normal. Now, how much electrical activity is happening depends on factors such as stress, movement, and temperature. Now remember, pain also travels through your nervous system. It's important to recognize that not all pain is bad. Pain can be a good thing. Nerves don't really send messages until there's enough activity to reach a certain point. It's like a pot of water that doesn't boil until it reaches a certain temperature. And when it reaches that point, it'll send a message to the brain to check things out. So think of stepping on a rusty nail. If you step on a nail, signals are being sent to your brain to let your body know that there is damage. Now, once the pain signals reach that specific point, an alarm begins to go off in your body. The brain hears the alarm and it knows that it has to do something. This alarm will alert your brain. If your brain perceives danger, it will produce pain to alert you. For example, that rusty nail needs to be pulled out. Pain is produced by your brain when it believes that you need protection. So remember, you can have tissue injury and pain. These are two different things. You can have pain but no tissue injury, and you can have tissue injury but no pain. So different aspects of your cancer journey can influence why you experience pain. It may be due to the cancer itself, such as a tumor pressing on your muscles and nerves, or it could be bone pain in advanced cancer stages. Chemotherapy can also cause pain, called chemotherapy-induced peripheral neuropathy, or CIPN for short, that can cause numbness and tingling in your hands and feet, along with weakness and inflammation. Healing after surgery can also influence your pain because of inflammation that is still present during your recovery. Radiation may cause pain if you're laying in the same position on the treatment table for a long period of time, or if you experience a skin burn after radiation. Undergoing biopsies or other testing can cause pain as well. People often use the word pain to describe discomfort. However, not everyone may feel pain. Some people describe pain as shooting, tingling, aching, or tightness. So, a combination of cancer treatments or other pain influencers can also be present, and these vary from person to person. So you may be asking yourself, when do I reach out to my doctor? If you experience pain that is new, different, or concerning, reach out to your physician and let them know about what's going on. Let's dive into the specifics a little bit more of each category, starting with surgery. Pain may be felt after removal of the tumor that can be present for days or for a few weeks. This pain will generally resolve itself. Like mentioned earlier, certain chemo regimens can cause CIPN. You may experience burning, numbness, or tingling in your hands, arms, legs, and feet that may cause difficulties opening jars, putting your earrings on, feeling off balance, or trouble walking. Radiation can cause hardening of the layers on and under your skin. So think of a kitchen sponge. When you open a sponge out of the packet, the sponge is easily flexible. But over time, that sponge will harden and eventually it loses its sponginess and its pliability. The same may happen to your skin. Diagnostic testing, such as bone marrow or tissue biopsies, can also cause pain that, similar to surgery, will resolve itself. Now that we've discussed what cancer-related pain is and how it presents itself, you're probably wondering, when should I consider cancer rehabilitation to help with my cancer-related pain? If you are noticing that your pain signals have become more sensitive, you may need cancer rehabilitation. Let's say you recently had surgery to remove a tumor and now you're experiencing post-surgery pain. Perhaps you underwent a stem cell transplant and you have bone pain, or you've received radiation even 1 year ago and are experiencing pain and skin restrictions with movement. More importantly, if you're limited in function, so for example, you're unable to bend down and put your pants on because of pain, or maybe your pain limits you from walking to the mailbox and back, cancer rehabilitation is a great treatment option for you. ReVital cancer rehabilitation specialists are licensed physical, occupational, and speech therapists that have undergone several years of education to obtain their degree. In addition to this, they've undergone intensive specialized training to understand the mechanism of cancer, the different types of cancer treatments, and how that affects function, mobility, and someone's quality of life. I have a specific patient story that comes to my mind when I think of cancer-related pain. I'd like to talk to everybody about my patient named Mary. When she first came to me, Mary was 66 years old and had recently been diagnosed with stage 3 breast cancer. She was seeking physical therapy services because she was falling at home and was having difficulty staying balanced. After her first evaluation, it was found that she was having severe pain described as burning and tingling in the bottoms of her feet and her fingertips due to CIPN from her chemo. It was difficult for her to know if she was touching a hot plate or a cup, and she'd actually burned herself once from not noticing that her cup of coffee was too hot. She also struggled with putting her earrings on because she didn't have the ability to place the backing of the earring on correctly without dropping it. At that point, she decided to seek out cancer rehabilitation services. I'll come back to her story in the next slide. So I call this mountain the mountain of pain. This is used to show how pain sensitivity can vary between people. Once action is taken, the alarm system should calm down to your original resting level. The resting level of that alarm system will vary from person to person from the get-go. In some people, nerves wake up easier, or calm down slower. In others, nerves may stay elevated and buzzing all the time, or stay elevated once the alarm goes off. It takes a lot less activity for these nerves to send messages. Once a nerve is sensitive, it makes it easier to send a message. Often before pain happens, you could do normal tasks easily and for longer periods of time, but now it may only take a few minutes. Mary was experiencing burning pain in the bottom of her hands and feet, and nothing seemed to make her pain better, and she started to feel depressed because she felt like she couldn't take care of her household and her family anymore, since standing and walking caused so much pain that she had to sit down every 15 to 20 minutes to give her feet a break. Her nerves have become more sensitive, and now something as simple as walking barefoot would cause pain, when prior to starting chemotherapy, she didn't have any pain at all. By attending cancer rehabilitation, she was able to recognize that her pain tolerance had changed due to her cancer treatment, and we were able to come up with pain management strategies that helped manage her pain at home. Not only do cancer rehabilitation specialists assess for pain, but we also look at other factors that may be affected by your pain levels. For example, you've recently undergone a mastectomy and are experiencing post-surgical pain. Because of the pain, you've limited the use of your arm with your daily tasks and are now experiencing arm weakness or stiffness. Or maybe you had a neck dissection that caused pain with swallowing, and now you're not eating very much. Because of this, you feel weak and fatigued with minimal activity that otherwise would not have caused you to feel so tired. Listed above are various components of an evaluation that your therapist will ask and test you about. For a PT evaluation, your therapist will look at your core and leg strength, range of motion of your arms and your legs, balance, posture, and perform a walking assessment. An occupational therapist will look at how you perform your daily tasks, fine motor coordination of your hands, grip strength, and can perform a cognitive assessment if you're experiencing forgetfulness or impaired concentration as a result of cancer treatment, otherwise known as cancer-related cognitive decline or chemobrain. Mary received both physical and occupational therapy because both her hands and legs were affected by her chemo. So what did Mary's evaluation look like? I started off by asking her to tell me about her medical and social history to make sure I understood the treatments she underwent and what her family and friend support looked like. I had her describe her pain to me. When was her pain better or worse? What did the pain feel like? How bad was her pain on a scale of 0 to 10 with certain activities? I tested her leg strength, sensation, range of motion, and performed balance tests to better assess why she was falling. Her occupational therapist tested her grip strength and looked at how she was performing specific fine motor tasks and her activities of daily living. After her PT evaluation, Mary and I came up with a therapy plan for her to come in and see me twice a week to address her most immediate concerns, which was her balance leading to falls and the burning and numbness in her feet. She was coming to see me every week, even though she was going through active cancer treatment. Your cancer rehabilitation therapist will determine a plan of care that best fits your schedule and therapy goals. So, for example, let's say you're scheduled to start radiation. You may be seen 2 to 3 times a week, leading to starting cancer treatment. And once you're going through radiation, maybe you come in once a month to work around your radiation schedule. That is the difference between regular physical and occupational therapy and cancer-specific physical and occupational therapy. We are educated on the side effects of cancer treatments and how that affects your day-to-day functioning, so we know how to best adapt your therapy goals and plan of care around your medical treatment. Cancer rehabilitation specialists can assess, counsel, and advise patients on how to perform physical activity as part of your pain management program, and most importantly, how to do it safely. We not only assess for musculoskeletal injuries, but we are trained to assess for cancer treatment side effects such as fatigue, weakness, and cancer-related cognitive decline. A multi-component program will be tailored to you based on your specific needs. So your therapist may work on restoring muscle imbalances, improving your posture that over time can lead to aches and pains, stretching muscles that are tense or tight, strengthening weakened muscles, improving balance strategies to keep you safe at home and in the community, and ultimately self-management strategies to help you control your pain at home. Let's go back to Mary. Her balance was improving with the balance exercises given to her in the clinic, and she was using a cane whenever she went to doctor's appointments or to the grocery store. However, she was still experiencing tingling and burning in her feet that would wake her up at night. I decided to apply kinesio taping to the bottoms of her feet. Kinesio taping is a tape that stretches and it's flexible. You may have seen athletes wear this during various sporting events. After taping her feet for a couple of visits in the clinic, I showed both Mary and her husband how to tape her feet at home. And can you believe it? After providing her exercises to lessen her nerve sensitivity and taping her feet for 3 weeks, Mary's symptoms had dramatically improved. She told me that the day before, she was able to go out on a date night with her husband for the first time in several months without experiencing pain walking to and from the parking lot. Next, I want to focus your attention to the emotional component of pain. This is a component of pain that you may not immediately think of, but it is just as important as addressing the physical aspects of pain. Listed are ways that you can address cancer-related pain at home today. Take a few minutes in the morning or before you go to bed to perform slow, deep breathing exercises to reset your system. Download a meditation app that can walk you through a series of meditation activities to start your day in the right mindset. Create a playlist of music that you like to listen to. Go for a walk with a friend or family member. Take a warm bath, or simply find an activity that you enjoy doing or someone that you can confide in to help calm down the pain and nerve signals during a difficult time. In Mary's case, she enjoyed taking warm baths in the evenings, followed by a game and movie night with her family. We understand that having a cancer diagnosis is not a one and done type of diagnosis. Cancer treatment may last months or years, and its effects on your function, mobility, and quality of life can be present even once you've entered survivorship. Because of this, once you're done with therapy, you aren't done with us just yet. We continue to see you in the clinic for 1, 3, or 6-month follow-up appointments, just to make sure your pain is staying well managed and there's been no change in your functional status. If during a follow-up appointment, there is a change in your pain levels, for example, you started a new cancer treatment, or simply you may be having increased pain for whatever the reason, we can develop a new therapy plan and begin seeing you in the clinic again until your pain is better controlled. You will work closely with your therapist to create a therapy plan based on your goals, impairments, and pain levels, as well as work around your work and your family schedule. Before I end this presentation, I want to leave you all with a thought. More often than not, I've had my patients tell me, there's just so much going on right now. I'm exhausted. I don't want to burden my family with my worries and concerns. I'm happy to just be here and be alive. Please remember that even though there will be multiple times throughout your cancer journey where you may experience pain, pain is a normal process. However, suffering from your pain is not something that you just have to deal with. Don't let pain be an overwhelming factor in your cancer journey. Be an advocate for yourself and let us be a part of your cancer care team. Thank you all for your time today. You can find more information on our program at ReVitalCancerRehab.com. We hope to help you live well beyond cancer.
Thank you, Daniela. That was fabulous. I am now going to give everybody the opportunity to ask Daniela and Jessica Bertram, who hopefully will appear on the screen shortly, any questions they have about how they can find a therapist and what it may look for them. Jessica is the director of Oncology Residency program for Baylor Scott and White. She's board certified clinical specialist in oncologic physical therapy, a certified lymphedema therapist, and a certified pelvic floor therapist. So I'm just going to get started with the first question for you, Daniela.
Yes.
How easy was it to teach your patient, Mary, to be able to do taping for herself and her husband? How easy was that for them to manage?
So it was actually a very good process, and she actually enjoyed it, and her husband were able to do it together. I was able to provide her with a handout, so that way it was easy to be able to replicate at home. And there were different patterns that she could follow. So we followed the same pattern that had been working for her in the clinic. And then being able to go home and replicate it was great for her. And all it required was tape and scissors, and she was able to get that done at home. So she was able to replicate it pretty easily. And there's a lot of reasons that they can use the tape, but in her case, it worked out great.
Yeah, I've had patients really respond very well to taping as well. Now we have Jessica, so I'm gonna ask Jessica to turn her camera on. And I'm going to ask a question to Jessica. And this question is, I've had pain since finishing treatment 5 years ago. can rehab help me?
Yes, absolutely. So cancer rehab therapists are specialized in the treatment of evaluation and treatment of pain. And so because, as Daniela said in the presentation, pain is multifactorial and there's many components of pain. Physical therapists have a lot of tools that they can use to address pain even years after the cancer treatment has been completed. Additionally, cancer rehab specialists are trained on how to treat patients that have been affected by cancer from diagnosis all the way through survivorship. And so that's definitely something we can address even years after you've completed treatment.
Yeah, Jessica, thank you. I think that is important for people to remember. I think people sort of live with pain for such a long time, often as in survivorship, that it is sort of surprising that we can make a change several years out, and that we do see patients at any point in their cancer journey. Next question I'm going to throw to you, Daniela. How can you help my joint pain caused by my hormone pill?
That's an excellent question that I actually have a lot of my patients ask me about, because the hormone pill can definitely cause some of those joint aches that you're speaking about. One of the best things that I can say, one of the best pieces of advice, is to continue moving. Moving and exercising has been shown to really help combat those aches and pains that you're having in bones or in even muscle aches. And so one of the most important things that I can recommend is just to keep moving, just gentle range of motion. And your therapist will be able to specifically sit down with you and talk about exactly where that pain is located, what makes the pain better or worse, and be able to tailor an exercise program specifically for that. But as long as you're able to get up and continue moving, it's a great place to start.
And I think, Daniela, again, another great point. I often tell my patients, I think people think it means you have to go to the gym 3 times a week. There's a lot you can do at home, and a lot of gentle stretching and walking and things you might enjoy that can still impact pain and the issues that you may have from your cancer treatment.
Yeah. I'm glad you brought that up, Kirsty, because cancer rehabilitation specifically is not just about getting you on an exercise bike or simply doing strenuous activity. It really is tailored specifically to how you're feeling, whether it's throughout the whole session or just during that day or specific point in time. So excellent point.
Actually, that sort of plays into our next question, which is, how often do I need to come into therapy if I'm having pain?
So all of the therapy plans are individualized based on the patient's needs. So when a patient comes in for physical therapy, the physical therapist or the occupational therapist will evaluate that patient. They'll do tests and measures to see where the patient currently is and what the patient's goals are. And then both the therapist and the patient will work together to establish what's called the plan of care. So that's how often the patient comes in and how long the patient will need to attend therapy. The patient and the therapist will also discuss and make a plan together the types of activities that they might do in therapy together in order to best meet the patient's goals.
Yeah, and I think that Daniela touched on that as well in her presentation, that sometimes you might come a few times a week, and then during active phases of treatment, that might change. And then into survivorship, that might change. I have several patients that they come in for what I call a tune-up. So we might touch base every 6 months after they feel that they've addressed their pain and that they have exercises. And that, again, is very individualized depending on the patient we're seeing. So another question I'm going to ask is, does a patient need a doctor's order to see you for therapy?
Yes. So we work very closely with the referring doctor who's coming in and giving you the referral. And so, yes, you will need doctor's clearance, so to speak, before you come in and start being seen for cancer rehabilitation. And it's also important to note that throughout the entire process, we work very closely with that physician, making sure that they're staying up to date as to the progress that you've been making. And so that way they're aware also of what is going on. But yes, you will need a doctor's prescription.
Excellent. And I think both of you work pretty closely. This surprises people sometimes, but that you can also find speech therapists and occupational therapists that can help with patients experiencing pain. I work with a speech therapist who will, a lot of patients going through radiation of the head and neck will get pain associated with that. And I'm sure that you guys at Baylor Scott and White see that frequently, that you work within a team to best meet that patient's needs.
Oh, yes, absolutely. A lot of the times I can think of several patients right now that both myself, the occupational therapist, and the speech therapist, we all work very closely, and we all make sure that we're covering all different aspects of whatever seems to be going on. So that way we're not, cross treating, and we're making sure that the whole patient is being seen. So yes, it's something that happens very often.
Right. The next question that I have, I'm going to ask you, Jessica. If I'm having too much pain, am I still able to come into therapy? What would that appointment look like?
That's a really good question, and a question that I get often. And I always tell patients at the very beginning that if you're in pain, please call me so we can discuss it, and don't miss those appointments, because the physical therapists and occupational therapists and speech therapists, like you said, have tools that they can use to address pain. And so oftentimes, if a patient comes in with complaints of increased pain, there's lots of different strategies that we can utilize to best address that pain and decrease those pain levels, so that they can get on with the activities that they want to do. And as far as what those appointments look like, as Daniela said during the panel and then during her presentation as well, each of the therapy sessions are going to be individualized for the patient, not only from patient to patient, but also from appointment to appointment. And so the appointments may look different at each time the patient comes, based on the patient's needs for that day or that week, whatever they have going on. And oftentimes the cancer-related treatments, as we learned from Danielle's presentation, can be a source of pain. And having the opportunity to attend therapy and have those pains addressed while you're going through the cancer-related treatment can be very beneficial for patients and their pain management.
Yeah, I wonder if you find this, but sometimes I find that patients just being educated and knowing, because we understand a lot about treatments, that just having someone to, as Daniela said in her presentation, pain does happen with treatment, but suffering does not need to be the way of life. And I think patients sometimes having someone who can just hear them and say, well, this is pretty common, and then explaining to them how to move through that is just something that's really beneficial for a lot of patients. Okay, this one sounds like I wrote it. I don't like or feel ready for the gym or strenuous exercise. Can this still help?
Yes, so I would say that coming into cancer rehabilitation and coming into your appointments, it's important to remember is that the appointments are not just getting and doing strenuous exercise. It's not just getting on a bike. There are multiple components and multiple ways of exercise that we can perform. Stretching is just as important as any kind of strengthening exercise may be. Working on balance is another great form of exercise that we can continue to work on that can help to address the side effects of any of the cancer treatments itself. Looking at posture or working on specific fine motor tasks in the case of seeing an occupational therapist. There are a lot of different strategies and a lot of different ways to exercise. So it doesn't always have to be strenuous. It can be something coming in, and if there's a day where there's more pain than other days, then we can always adapt to that as well. But remembering that all of these clinicians that have gone through the ReVital Cancer Rehabilitation Program, all of them are certified and know exactly how to best work through an exercise that may be too strenuous, and then also know how to progress you appropriately from there. So all of that is customized to the patient.
Yeah. And I think I still hear that from patients, this expectation that physical therapy is really hardcore and they have to be on equipment and working out for 45 minutes at moderate levels. And really, I do think that's what set ReVital apart, is that we look at the patient and then we look at their interests and we look at what they're trying to achieve, and we can work around that. Okay, Jessica, the next question is, can I come to therapy if I am taking chemo?
Absolutely. So as I said earlier, the ReVital therapists are trained to treat individuals affected by cancer from diagnosis all the way through survivorship. So that includes while they're, before and after surgery, during chemotherapy, during radiation, before and after those treatments as well. And as we've talked about during this panel, because the therapy sessions are individualized, we can adjust both the frequency of the visits and also what we're doing during those visits to best meet the needs of patients that are undergoing chemotherapy. Anyone that's undergone chemotherapy experiences ups and downs. They have good days and bad days. Days where they don't feel like doing anything and days where they feel great. And so the therapist can work with those patients to strategically schedule the therapy visits, and then strategically plan out what they're going to do during those therapy visits to best maximize the quality of life for those patients during chemotherapy.
Yeah.
And I will, I'm sorry, Chrissy, I was going to say, I will say I've had multiple times where patients have come in and they maybe just had a chemo infusion that day, and they come into the clinic and they're like, today is not feeling my best. And after the session, they said, you know what, I'm glad that I came in because at least I was able to get up and move. And so that is something that it's very commonly seen, and you can leave feeling even better.
Yeah, I agree. I have someone at the moment who has now finished chemo, but it was a long, hard course for them. And there were times when she certainly didn't feel like coming in, and we kept her on just once a week. But now that she's out of it, she's really thankful that we really educated her about that, as well as sort of encouraged her, but worked with where she was at. And she sort of sees she's not as far maybe down in a hole as she would have been coming out of that treatment had she have just sat at home that whole time. Mm-hmm. We have a great question about tele-rehab. So the first part of it is, do we offer tele-rehab for our patients? The answer is yes.
Yes.
And I know I'm based in Tennessee, but I know in my state and in many states that we offer physical therapy, occupational therapy, and speech therapy via tele-rehab. Are you able to talk us through, Daniela or Jessica, maybe what one of those sessions would be like for pain management?
Yeah, so tele-rehab or telemedicine is going to vary by state to state. So you'll want to check with your local physical therapy ReVital provider to see if they have tele-rehab available at their clinic. But if they do, tele-rehab, Daniela actually addressed a lot of the ways that we can help with pain management. One of those is teaching kind of self-management techniques or education techniques for patients that have pain. So stretching and breathing exercises, also different things like keeping a pain journal or energy conservation techniques, and other like activity planning. Activity planning strategies can help with pain management. And so there's a lot of education that we can do for pain management, and in order to keep you off the top of that mountain, like Daniela was talking about. But also there are also some exercises specific to pain management. And some of those include not only stretching, like I mentioned before, but also strengthening. So oftentimes pain is present if there's weakness in the area. And so some gentle strengthening exercises can help decrease stress on the joint or muscle that's in pain.
Yeah, agreed. And I actually do a lot, and I'm not sure what your thoughts. I do a lot about positioning. I get a lot of patients talk to me about pain during the night and the position they sleep in. And when we explore the position they sleep in, it may be in a recliner. There are many reasons, but we talk about positioning and when to use the energy that you have in your low pain times. So when to do those tasks of what we call activities of daily living, and how to plug them into the day so you're not like jumping on top of the mountain and making sure that you hit that threshold. Next question. Does my therapist communicate with my doctor so everyone stays on the same page regarding pain levels?
Yes, absolutely. So just like we require a doctor's referral for you to come and see us, then we always make sure that we are keeping your physician up to date as well with the progress that you're making, because it's important to note that this whole cancer journey, of course, includes the cancer treatment, but also about the quality of life that you are then able to gain back once you're currently going through and even once you've completed treatment. And so it's important for your physician to stay up to date with all of that as well and make sure, we're maybe, catching something because we have the ability to see you for longer. And so if there's something that's happening on the day to day, we're able to clearly communicate that to your physician as well. And so there's always a clear communication path there.
Yeah, I have found because we spend probably more time with our patients than they often can during medical appointments, that we can often give information back to the doctor about the type of behaviors or activities, or when their pain is worst. And patients have really appreciated that line of communication that I've worked with in helping, again, many of them really. I think the research shows the percentage of patients who do not mention pain to their doctors is a lot higher than we would imagine. So we're sort of like the advocates for patients when they're dealing with pain, and we can communicate that with the doctor. So how should this is the next question. How should I ask my doctor for an appointment with you?
That's a great question. And so I think a couple of things could happen. One, I think being open, first of all, planning ahead. So oftentimes I know when I go into a physician's office, I feel flustered and I have a couple things that I want to ask my doctor. And then I get in there and then I walk out and I haven't asked any of them. And so jotting some notes down before you go into your physician's office will help make the most of that appointment time. And I think that will help keep your making sure that you get all your questions asked, but also make sure that you get all your needs met as well as a part of that medical appointment. And then secondly, I think cancer rehab has grown significantly over the last 10 to 15 years. And physicians, especially oncologists, want their patients to experience a quality of life following the cancer treatment. And so oftentimes, even if they've never heard about it, if you can communicate kind of what you heard and kind of what your goals are, and you think that physical therapy might be a good option, physicians are open to sending their patients to physical therapy, because as the physicians and the physical therapists, as we mentioned before, we're all part of the team. And so the physicians have amazing skills in identifying and treating cancer, but their skill set is not in the management of pain and in more like the activities of daily living training. That's not their level of expertise. So they rely on their team members in the rehab department to restore that quality of life, the return to activities of daily living, exercise. And so I would talk to them about physical therapy and your desire to make improvements in specific areas of your life.
Agreed. I've never had a doctor who has said, no, I don't think therapy would be a good option for you. And I will say, we'll talk to this at the end, but ReVital Cancer Rehab is our website. We have a locator on the website. We have all our past presentations on there. We have other patient information about our program. ReVitalCancerRehab.com. The next question I have is, can someone discuss the issue of insurance coverage for PT and OT and the best way to address issues if prior approval is not approved by insurance companies? And I'm thinking they're saying, what do we do when we don't have benefits for OT and PT? But I'm not 100% sure on that.
Well, first of all, cancer rehab is covered under standard PT and OT insurance coverage. So if you have physical therapy and occupational therapy insurance benefits, then cancer rehab, everything we've been talking today, is covered under those services. Now, if you do not have any physical therapy or occupational therapy benefits as part of your insurance plan, then most plans offer a couple different, or most clinics offer a couple different options, depending on your, depending on where you live. You would want to use that ReVital Cancer Rehab locator button. Yes. And find a clinic near you and ask what options they have for someone that is uninsured or doesn't have, maybe not uninsured, but doesn't have the therapy benefits. I know at Baylor, where Daniela and I work, we have both a charity program where we provide services pro bono, as well as payment plans available for patients that require therapy services. But contacting that local clinic is going to be your best bet to see what options are available for non-covered services.
Yeah, I agree. I would say ReVital is a national program, and each state and clinic has different insurances and different laws regards to how therapists are able to do that. So if you reach out to ReVital, we will do our best to get you the care that you need. I often help patients just sort of sometimes problem solve that. That is it for questions today, ladies. I want to thank you both. I think it was a great conversation. My takeaway from this is that pain may be part of the journey, but we don't want suffering to be part of that journey. And that cancer rehab is really one of the keys in getting you back to the life that has at times been saved by your oncology team. We want to get you back to living that life. Our next presentation, for those that are still with us, will be in October. Keep an eye out for an email after today's presentation. We're going to be discussing cancer-related cognitive changes during our October presentation. That's a big need in the market. You can also register or watch past presentations and locate a cancer rehab specialist on our website, www.revitalcancerrehab.com, or you can call 844-473-8485, and you'll be able to follow up, and we can have a ReVital therapist follow up with you and speak about whether cancer rehab is right for you. Also, keep an eye out for us on social media to stay up to date on new information, our stories, new resources, and any upcoming events. We hope you found today's topic to be valuable. And if there was a question we did not follow up on, we will reach out to you by the end of the week. We look forward to helping you live well beyond cancer.